Hi, everybody. Good evening and welcome to Momcology's Caregiver Lounge. We're so excited that you're here. I'm Kat Pachente with Momcology. Uh, from our team tonight, we have Layla Zangle, who is running our production and will be joining in with Amy and me during the question and answer period. Um, we are very excited to bring the topic, the very important topic of navigating grief to the community tonight. It's a difficult one and one that is important that we talk about together. I would love to welcome Amy Steele. Amy is our presenter tonight. She is a pediatric psychologist and chief of the Division of Pediatric Psychology and Neuropsychology at Levine Children's Hospital in Charlotte, North Carolina. Amy is also a very valuable member of the Momcology Medical Advisory Board. We love having her with us, and we're excited to have her here tonight. Her bio will be in the chat if you want to learn a little bit more about Amy and her background. Um, Dr. Steele, welcome to our couch. We're so happy to have you with us.
Again, I really appreciate everyone being here, and I know folks might stream in, as I'm sure 8 p.m. is a busy time for all of us, kind of at the end of the day and trying to wrap things up. So I'm thankful that you have chosen to be here. We are going to dive into this topic tonight, navigating grief together, supporting families through change and loss. And I really like to start presentations by sharing a little bit about myself and a little bit about my journey, because I think that gives some insight and perspective as to who you're hearing from, not just as like this clinician or, a supposed expert, but also, as a person, as a human. And I believe that human connection is so valuable. So I'm a wife, a mom. I was just telling Layla and Kat, I was running down I happen to be home tonight. And so if you hear a rogue dog bark or something like that, hopefully it doesn't happen, but it may. I was running, downstairs after putting someone to bed. And so I am a wife and a mom, like I mentioned. I'm a new puppy mom. So we have our dog Joy, who is full of energy. She's a mini Labradoodle down on the bottom of the screen. I really, really love to travel, and that's a picture of me in Portugal, which was very lovely, and also recently on the news with their power outage as of last night. I also really, really enjoy being in nature. It really grounds me and is a place of healing and a place that is supportive to me. And so I'm also really close with my family. I'm an only child. And so I think with that comes some unique aspects and also probably challenges, I'm sure. But those are my parents, my husband, and my daughter and son, James and Charlotte. And as you can tell, my family's all quite short, and then my husband's like up tall in all of our pictures, which sort of just cracks me and my parents up. And then, like Kat mentioned, I do lead a team of mental health professionals, mostly pediatric psychologists and neuropsychologists at Levine Children's. This was us on a mental health awareness day at the top of the screen there, with many of us showing off our Mental Health Matters t-shirt. So like I mentioned, I think it's important to just kind of see and get to know someone, and I'm very appreciative that you guys are here. Oh, and I forgot to mention the haggard looking Mona Lisa at the bottom. I'm actually going to start my timer here to keep me on track, because I could go on and on, but I'm going to try to keep us on track tonight. I really love connecting with other people, and if people ask me for time, one of the things I'm trying to get better on is actually setting some more firm boundaries. And I know I've presented on that, through oncology and other avenues, but I will often fit people into my schedule, sometimes making me look like the haggard little Mona Lisa down there. But I also feel like it's important to connect with others. So I'm not sure how many people are streaming in, and folks might stream in during this, but part of what we'll be doing tonight is some experiential learning in addition to covering this topic of navigating grief and change and loss, and really talking about change and loss throughout the cancer journey. So I'd like to really invite you to start with a grounding exercise. And like we all said, no one can see you. In fact, I just see my screen and then my little square with my face in it. And so I'd like you to just take a moment. This will be about 3 minutes or so, just so you know what to expect, and settle in into a comfortable seated position. You can be on a couch, the floor, your bed, a chair, whatever is comfortable for you. We're just going to do a brief grounding activity to really invite presence with our group, even though we are virtual. So sit comfortably wherever you are. Close your eyes if that's accessible and feels comfortable to you, or soften your gaze. Maybe look out in front of you or down to the ground. Focus your attention on your breath. Notice how the air flows in and out of your body. There's no need to change anything with your breathing. Simply become aware of breath. Next, shift your focus towards yourself. Go inside. Ask yourself a question. How am I doing tonight, right now, right here? Notice if any thoughts or feelings or physical sensations come up for you. It's not necessary to change anything nor to judge it. We are simply observing what is going on with us right now, being present in the moment without judgment. In fact, that is mindfulness. Finally, you can ask yourself, what do I need right now? What can I do for myself, perhaps right now, for the next 40 or so minutes, or perhaps later after this presentation? Maybe something will come to your mind, but if it doesn't, that's also fine. I invite you to take 3 deep breaths to really round out and complete this mindfulness check-in. And then calmly, at your own pace, come back to this room, to this space where we all are here tonight. I really appreciate, like I've said, and value your time, and I hope to make this useful. And I appreciate you engaging in any of these exercises to whatever extent you feel like they're accessible or doable for you in the moment. And I also will acknowledge and understand if you don't want to do it, and your presence here tonight, just making it to hit, join is all you can do. That is more than enough in this moment, more than enough. All right. Let's talk a little bit about an overview of where we're headed tonight. And I will apologize because in North Carolina, everything is blooming. And so I just have this post-nasal drip and I have 3 beverages here. So you may see me just drinking a lot of hot tea and water and or sniffling. So I'll apologize in advance for that. We're going to dive into what is grief and talk about some definitions and how we talk about it, both in everyday language and then also a little bit in the research. We're then going to flow into understanding the emotion around grief and loss and some of the emotions that people may experience. We're going to talk quite a bit about the loss of normalcy, which is something I'm sure that we can all relate to throughout the cancer journey, no matter where you are on that spectrum. We're going to engage in a self-compassion exercise, talk a bit about bereavement and loss of life, and then talk about general coping strategies and support for navigating change really throughout each of our lives individually, but certainly in relation to childhood cancer. And then I also have a guided reflection questions with some writing prompts at the end that we can get into. And then I have left plenty of time for questions because I would love to hear from you and what's on your mind and what may have come up tonight for you as we've gone through the presentation. So let's start by talking about what grief is. When I saw this visual of this European statue, and now I'm mindful that I was going to look up exactly where it is in the world, and I did not do that for you, so I apologize. Um, when I saw the statue, I immediately thought about grief and just despair and um, just missing, like a piece is missing. And it was during a presentation at a professional conference that it happened to be talking about grief and bereavement and things like that. And I was like, what a perfect illustration that is so significant that we often can't put into words, but much like art does for us, it really helps us really elucidate this feeling that sometimes we can't put into words. If we were to use words and we go to, the dictionary and other things, we find that grief is a natural and often emotional response to loss. So grief is this natural, often emotional response to any sort of loss. So this can be loss of routine, loss of the expectations that we held for ourselves, loss of innocence, loss of control, or certainly loss of normalcy. It does not have to be loss of life or loss of a loved one. So let's talk a little bit about the types of grief that really can come to us in various aspects of the cancer journey, and then also through various losses that we may experience throughout our lives. There's anticipatory grief, which is really the grieving of something which has not yet happened. So we can grieve for something that we think may happen. We can grieve for something that, may have a slight chance of happening. Um, and then certainly we can have more significant grief about something that we anticipate may very well happen and happen soon. So anticipatory grief is really that understanding of grief prior to something happening. And there's also ambiguous loss and grief around an ambiguous loss. And that really is sadness and this emotional response to something that happens that doesn't have a definitive closure or finality to it. Circumstances really might be unclear. So if we think about outside of cancer, but a missing person or something like that, that can be that's a very common example of something like ambiguous loss, that there's really no finality or closure. In the cancer journey, I think of things like we don't really know about things like relapse, and we may grieve or anticipate or have a lot of anxiety about something that could be ambiguous. Is that going to happen? Is it not? Could that also be anticipatory? Absolutely. Um, I think there's a lot of things, the cancer journey is often really unknown and what comes next. And so there's a lot of ambiguity, a lot of paths that could be taken depending on where you're at. And so there certainly we can experience some ambiguous loss there. And then certainly most often, I think when we talk about grief, especially in the public, and if we just say that, folks are often referring to bereavement and loss of a loved one and loss of life. But again, throughout the cancer journey, at any stage of the cancer journey with your child, there can be, and I would counter probably there are some aspects of loss, change, uncertainty, and grief that may occur. For example, at new diagnosis, perhaps grieving the life that you imagined for your child, right? Like when we have a child, we may, even without really trying to put it on them, have these hopes and dreams and this life that we imagine for them. Then we get the little person and we start to learn and we think about what that may be like for them without our own definition. And then there certainly can be treatment losses along the way. So loss of hair is a big one, right? Changes in functioning for the child, loss of health status, right? Loss of independence, both for you and for your child, or maybe your partner as well. Loss of normalcy and routine, things like that, that we will keep going into. So let's understand a little bit about, we've talked about grief, some types of grief and loss, and then let's understand some about emotion that can accompany grief and loss and get more into that. So grief is inherently an emotional response. And there really are a wide range of emotions that may accompany grief at any part of the cancer trajectory. And so some of those that are more common are anxiety and fear, numbness, anger, sadness, indecision, and isolation. But there can also be those unexpected emotions, such as relief or jealousy or hope, that may partner and come along with a loss, a change, grief, other things that we may encounter. We also know and understand both from probably our own lived experience and looking at the clinical research that grief is such an individual experience. No two people are going to experience loss in the same way. So it's highly individual. We know that it has a ton, it is inherently emotional and highly individual. And so probably relies a lot on that person, their personality, how they cope in general, and there can be really unique differences. So our emotions also can act really as filters. Filters for how we perceive the outside world, how we take in information, what we do with it. In fact, if we think back to an example of like rose colored glasses, right? There have even been songs about this. If we like the color pink and perhaps rosy things, and we associate that with happiness, if we have on these, happy emotions and we're feeling quite happy that day in these rose tinted glasses and we start to look around us in the world, we may look for information that confirms, that's something joyful, that's something happy, right? It's confirming this emotion that we have as our filter that day. On the other hand, if we're already irritable and we're running late and the dog runs out of the house and gets into the mud, not that I would know because these are examples from my life, and I'm already running late and irritable, then I'm going to look for information about how that then makes me a bit more irritable, right? And it may lead to me getting more angry or upset or frustrated in that morning, right? So emotions can show up for us and filter our perception of the world, filter the information, and also give us a lot of information because at the end of the day, our emotions are really there to give us information. It's not our job to change our emotions or our feelings, but it is helpful to be mindful of them, be aware of them, and also understand that no matter what emotion we have, often if we acknowledge it, if we're mindful of it, if we say, oh, hey, there's that jealousy feeling again that I keep having. If we're mindful and acknowledge it, then generally that emotion will decrease in intensity over time. Versus if we stuff it down and sort of avoid, it may come out in ways and often will come out in ways that we don't want in the future. So, something that can help with a little bit of coping with intense emotions or even with emotions in general, if they can be hard or overwhelming, we can give ourselves some distance and some space from those emotions. So instead of, we often say, right? We often say, oh, I'm so anxious. I am just like a ball of anxiety, right? That shows that like anxiety and I are like very cohesive, right? Like we are enmeshed and we are one and the same. Whereas if I say, here come all those anxious feelings again, like I'm having all those anxious feelings, the anxious feelings are like trying to overwhelm me, and it's the anxious feelings. And so I often find that, and I pretty much teach everyone this, and anytime that they'll listen to me, that if we can distance ourselves a tiny bit with some bit of emotion, then it allows us to just have a little bit more space to think about the emotion and not be so engulfed or overwhelmed by them, even sometimes positive emotions, right? Because we know the positive emotions are not always going to hang around for that long either, and their intensity is going to dissipate. So again, I'm having feelings of, or oh, here comes those feelings versus I am whatever the feeling or the emotion is. And particularly with regard to change and loss and navigating through those, that can be significantly helpful and a relatively simple intervention if we are mindful of the emotions that we're feeling. So again, just kind of recapping this one, grief is inherently emotional. Our emotions really allow us to filter information, change our perception of the outside world, and they are highly individual. So if you think about this in relationships, if two people are grieving change and loss and navigating change and loss, two people are going to be coping with that very differently, expressing very different emotions and showing up with different experiences of grief. Okay, I'm going to take a sip of tea here. So when a child is diagnosed with cancer, there's a ton of change, right? I know, especially within the oncology community, we talk about change, a new normal, coping with the new normal so much. And so when a child is diagnosed with cancer, there is really a lot that can be grieved because there is so much change and so much that we think about that could be lost, a departure from what we generally know and expect, right? So we're losing grips on things that we have known and come to see as routine. And a lot of times things like this are called secondary losses. So when a child is diagnosed with cancer, we're losing really their health status, right? So they're becoming this child with a major medical condition. That's our primary loss that we have. But then there's all these secondary losses, and this graphic really shows it kind of nicely. And I also loved it because it was colorful that come along with this, both for the child or teen or young adult, and also for ourselves as caregivers and parents and moms and dads. Some of those secondary losses that I think most people can relate to, especially right after diagnosis, are really loss of identity. You may have been, a working parent, and now you are thrust into this role of primary caregiver. Oh, by the way, we're asking you to basically be a nurse at home because the amount of expectations that we put on our parents and caregivers when their child is going through cancer just keep going up and up and up and up and up. And we just keep asking. So, meds and infusions and this and feeds overnight and when you sleep, I'm not sure, but we're doing it. So loss of normalcy, loss of identity, perhaps loss and certainly loss of routine with that loss of normalcy. you know, there's a lot of loss and change with regard to how we celebrate anniversaries or milestones or holiday traditions, right? Are we going to be in the hospital on, Thanksgiving or Christmas? Can we have all of the people if our child, just had chemo cycle and if they're immunocompromised and, things like that. So I think the way in which we do things, a change or a loss in income, again, if you or a working parent and now there's only one income or no income at this time. So there are many changes, losses that parents of children with cancer, whether or not they're in treatment, off treatment, or bereaved, have to deal with on an ongoing basis. Let's dive a little bit more into loss of normalcy because I feel like that's one that we pretty much always talk about and most people can probably relate to. When you hear that your child has cancer or when you are going through a significant medical journey with your child, it's inevitable that you may mourn the life that you thought that you would have, in addition to mourning the life that you thought about for your child. Again, thinking about these shifts of identity that happen ongoing, no matter where you are in treatment, right? So even if you're off treatment, then there are constant shifts in identity depending on what your role is in the home, within the family. There can be strain on family relationships and roles and routines because you're constantly navigating where your priority must be. You thought you had your priorities in order, maybe perhaps before your child got diagnosed, and then once they did, there can cause a lot of strain and this constant jockeying or navigating of where priorities lie and then where you as a caregiver must use your attention. And then again, like I mentioned, navigating milestones differently is something that absolutely may occur. Going back to school, where your child go back to school, how will school look? Do they have late effects after their treatment? I know that we have some parents on tonight with the children who are off treatment. Do we have our 504 and our IEP? And what will friendships be like for them? And what will friendships be like for me as the caregiver when basically for the last 2 to 3 years, I have had absolutely no time for that because I've been focused on really just trying to connect and survive and take care of my child and my family and maybe myself. So I think as we're seeing, even throughout this journey, there are many things that are going to change and many things that may be lost as a part of having a child with cancer. Okay. So we've been talking for a little bit, and my next experiential thing that I would like you all to do with me is a self-compassion break. I really also like this visual because I find that the community of momcology is so special, and it's been a really unique thing. A parent brought this to me, I don't know, like 11 years ago, maybe longer or somewhere around there, at Levine, and said, hey, there's this really great organization, momcology. And I think, I really looked into it and then said, wow, like this is so amazing. And I think the connection that you can get with um, one another who may have shared and often have quite a few shared experiences is so unique and so helpful, can be so helpful. So again, I think it's such a unique thing to be held and be in community. And I thought this graphic was kind of nice with that. So with regard to self-compassion, some of you might know about this, and if not, I want to just kind of give a quick 30-second overview of it. Often we are showing compassion to anyone and everyone around us, right? Our child who needs it, our significant others, our family, the people at school, maybe at our job. And when we look back at ourselves, if we even have the time, we likely are not showing that same level or depth of compassion to ourselves. And really, over the past probably 15 years, there's been a lot of information in the literature about how practicing self-compassion, because lots of us do well with putting compassion out this way, not as much of a focus coming back toward us. When we practice this, we can have significant impact on reducing anxiety and improving mood. And it's relatively simple, and I'll guide you through a quick practice of it. But that's the whole idea behind showing yourself compassion. I must admit that probably about 15 years ago, I was sitting at a conference and someone led us through self compassion, and I had not heard of it, and I hadn't heard of the really wonderful Kristen Neff, who's done all this research with this and pours her heart into making free, accessible trainings and things for people. And I was kind of like, really? I don't know. I'm not burnt out yet. I don't know that I need this. Turns out I could have really used some of that back then. It probably would have helped me along the way. And so I'm really happy to report that I think it is taking off more and more and more now. Okay. Like I said, I can't see you. So maybe relax in, get comfy. If it feels comfortable for you and if it allows you to focus, you can close your eyes, maybe take a nice big breath in through your nose, out through your mouth. Again, if you'd like, you can close your eyes or avert your gaze down or leave them open, whatever's most comfortable. I invite you to think of a situation in your life that is difficult. It can be your child being diagnosed with cancer or any other thing that has come up for you tonight as we've been talking. Bring to mind something that causes you stress. Call that situation to mind and see if you can actually feel the stress and emotional discomfort in your body. Now, please say to yourself, this is a moment of suffering. Alternatively, you could say, this hurts. This is stress, or ouch. Now, say to yourself, suffering is a part of life. This is common humanity. Other people may feel this way. I am not alone. We all may struggle in our lives. One of those or many of those may resonate. You can repeat any or all, whatever feels comfortable to you. Now I invite you to put your hands over your heart. Feel the warmth of your hands and the gentle touch of your hands on your chest. Or adopt the soothing touch that feels right for you. Whatever may feel right and comfortable in the moment. Say or think to yourself, may I be kind to myself. May I be kind to myself. You can also ask yourself, what do I need to hear right now to express kindness to myself? Is there a phrase that speaks to you in your particular situation? Such as, these are just a few. May I give myself the compassion that I need? May I learn to accept myself as I am? May I forgive myself? May I be strong? May I be patient? And with the close of the practice, I invite you to take another deep breath in through your nose, out through your mouth. Perhaps shrug up your shoulders and move them back and away from your ears. Maybe one more time, shoulders up, shrug back and away from your ears. And come back to this place all together. Open your eyes if they were closed. Know that this practice can be used anytime, day or night, anytime that you need it. There are really three aspects to self-compassion exercises or a self-compassion break. The first is bringing to mind or calling to mind that stressful situation and acknowledging that that's a moment of suffering. That's a moment of hurt or stress. The second part is acknowledging common humanity, or that the stress that you are feeling, that you're not alone in that stress, that other people, even if their issues may be different or they're thinking of something different, that other people may also struggle and other people may feel the same way that you do, that you're not alone. So a moment of suffering, common humanity, you're not alone. And then the next part is being kind to yourself or having compassion toward yourself, giving myself the compassion that I need, accepting myself as I am, being patient with myself. So thank you all for also doing that one with me. Self-compassion break. Okay. So let's gently acknowledge and discuss grief at loss of life. And I'd posit that this is, and the research literature shares this with me, that this is one of the most difficult losses that anyone can ever face, is the loss of a child. And like I mentioned, research supports this. I will say in my own personal journey that as a fellow way back when I was in Columbus, Ohio at Nationwide Children's Hospital, I did both clinical work and I did research as part of my postdoctoral fellowship training. And to this day, one of my most impactful training experiences has been talking to and gathering data, or really clinical interviews, from bereaved parents and bereaved siblings who lost a child or a sibling to cancer. They were part of this research study, and we went and met with them in their home and spoke to them and really heard from them. And I think that in order for any of us to do good clinical work, we have to hear directly from our patients throughout the cancer journey. But bereaved individuals and bereaved parents in particular are often underrepresented in research. And so I think when we do it right and when we get it right, then it can be profound and quite helpful in how we thus take care of one another and how we take care of future patients and families and things like that. Okay. So bereaved parents, let's talk a little bit about adjustment with bereaved parents. So bereaved parents are at risk for anxiety, depression, suicidal ideation, suicide completion, poor physical health, and grief can impact parents' well-being and quality of life, and it has far-reaching impact on family, so extended family and social relationships. I click the chat, it makes me re-click something. Okay. Also with siblings, we know that from the literature that kids can have a wide range of responses to things. How they cope can include internalizing things such as going into themselves and having a depressed mood, being depressed, having anxiety, or externalizing things such as acting out or risk-taking behaviors depending on their age and things like that when they lose a brother or sister. And for many parents, their partner can be, if they are partnered, their partner can be an important source of help and support throughout the bereavement journey. However, like we talked about, grief is very individual. And as we'll see in some examples a little bit later on, parents may have vastly different styles of coping, and that may impact one another. Not to mention, if someone is not partnered, they may not have that support or seek it from other support sources. So mothers are often described and describe themselves as doing predominantly mental activities for coping with the loss of a child. Things like meditating, reading, journaling, crying with a friend, things like that. Whereas fathers often report a more active coping style, things like getting into a sport or riding motorcycles or making music. Fathers also, interestingly, are more likely to return to work more quickly compared to mothers. So a lot of parental differences and individual differences certainly along the way. So with all throughout the cancer journey, we talked about loss and change, right? But certainly at loss of life and losing your child, there is a ton of secondary loss that may accompany that at the same time. So certainly the identity loss, right? So perhaps for the past years, you have been caring for a child and then all of a sudden that child's no longer there. And so losing that identity as parent or mother to that child, if you have other children as well, perhaps loss of friendships, loss of the healthcare team support. In some of the research that I did, the loss of the support from the healthcare team was really profound and significant and came up in many of our conversations with bereaved families. Because even going to off treatment, when you've had the support of all those people on your child's healthcare team, and then all of a sudden you're like, okay, go forth, back to normal life, or okay, well, we're not going to see you every day because you're not here, or every week or monthly or otherwise. It can be a significant loss. And so there are many secondary losses that may come along, just like throughout the cancer journey, but certainly with bereavement as well. I wanted to talk a little bit about and bring up dialectical thinking because as I continue to work with bereaved parents, many things that come up for parents when I speak to them is just this profound sense of guilt at surviving their child, guilt at perhaps having any sense of purpose or joy or fulfillment after the loss of their child, and how could they possibly feel happy or laugh when their child's not here with them or when their child's not able to do these things with them. And so dialectical thinking involves recognizing and trying to integrate two really seemingly kind of contradictory, maybe you could even think of them almost as like opposite ideas or emotions, and really trying to look at that from a big picture type of stance. So it can be something like, I can experience joy in my day-to-day life while also experiencing this profound sense of longing and grief and loss for my child. And so dialectical thinking allows us to, it's really a concept that's used in a lot of different types of therapy, but I think it can be particularly profound when thinking about bereavement. And I often share this with my families that I work with, is that we can have two things be true at once, even if they seem somewhat opposite. We can hold many types of emotions and feelings at once, and they can be there in varying intensities. So I can be happy and cheerful that my son is graduating high school, and I can be sorrow. I can have a lot of sorrow and longing and a lot of sadness that my other child who died will not get to do these things, right? So I can have these two things at once. Sometimes people describe them as guilt or as feeling conflicted or as really like self-monitoring so that they don't have too much positive emotion after losing a child. So I think that dialectical thinking is another one of those kind of like emotional interventions that I'm throwing in there for us that can help us both understand how we might cope and process and hold all the emotions, because emotions are neither inherently good or bad or positive or negative. They just are, right? Giving us information that we need to pay attention to. We can be mindful of them, and we can hold two things that may seem opposite at the same time. Other things that bereaved parents and siblings often talk about, and things that can be really helpful for them, are continuing bonds. This can also be outside of the cancer literature for sure, and outside of the parent child or sibling relationship. But continuing bonds are basically connections with the deceased loved ones that could provide some comfort or some ease. It can help the transition from that person being physically present with you to that person then being physically absent. And so continuing bonds are just these ongoing relationships that we may have with a loved one that is deceased, or in this case, a child that has passed away due to cancer. So there's a few different types of the most common continuing bonds. Some of those were the parents most often say, and most of the research really is done on moms, but we do have information for moms and dads. But a lot of it is really visual representations of the child that they lost. So photos and videos and listening to recordings of their child to kind of maintain that bond, that parent child bond. And as I talk about with all of my bereaved families, you are always mom or always dad, always grandma and grandpa to your child, even if that child is not physically present with you. Also, another continuing bond that's quite common that parents report is communicating with the child. So that could be silently or talking to the child each day, almost like praying or meditating at times to or with the child that you've lost, or young adult, adolescent, and then perhaps even writing letters. One of my parents who I work with to this day writes, and it's been, I don't know, years and years, maybe 5, 6 years, a letter to her son each day at the end of the day. Um, and then keeping belongings or items that may have belonged to the child. So keeping a stuffy or a teddy bear, a favorite jersey, a blankie, a car, driving a car afterwards to like feel the presence of that, teen. And then activities can be another continuing bond. So engaging in activities that your loved one really enjoyed or would have wanted to do when they were more healthy, doing things that they liked and enjoyed, or doing activities that may honor them and keep their legacy and their memory going. Okay, so there's really nice, before I get too busy here, there's this really nice new study that was looking at bereaved parents, moms and dads, from 2025, which is great. It's the most recent one I could find. And it really talks about support experiences that moms and dads received or wish they had received after the loss of their child due to cancer. So this was very specific and applicable to the audience. So I kind of just wanted to talk in the family's words some things that came up for them. So if we think about informal support really being the support that we may get from friends or families, siblings, things like that, that's what we mean by informal support. So this is Ava's mother saying, I always told them it would have been nice, and she was likely talking to like her family or talking about family. It would have been nice nice if you had written, just I'm thinking of you, something like that. Pretending as though she never existed is what breaks my heart each time. Celebrating Christmas when she is no longer mentioned is difficult for me. So I think this really speaks to this ongoing legacy work and memory of saying the child's name, talking about them, sharing wonderful memories, even if it brings up emotion. But keeping that child's legacy and that memory alive with their parents and others around them. So this is talking about sibling support. And again, I mentioned that kids can cope in all different kinds of ways. So this is a mother of Paul. And the mom says, I also imagine that we would just all be together on the sofa and take each other in our arms and be a little sad together. For my children, it was just that life went on. They didn't shed a tear, right? And so for her, this was deeply impactful as a mom who obviously is coping very differently than maybe the siblings of the child who died are coping. And then another one with regard to a mom talking about a partner. So this is the mother of Robin. And she says, usually it's not the case that everyone's so sad at the same time. And I think it's also important that people are just nice to each other. You don't judge. We've done great with that. So my husband sometimes, when it was difficult, he has to ride his bike. For me, it would be a horror if I had to ride my bike when I was sad. When you judge each other, whether coffee with a friend is better than cycling alone for an hour or crying a lot, if you go down that road, I think you've lost as a family. So this really also highlights some of what we were talking about earlier with individual coping differences, how mothers and fathers may cope differently, how partners may cope differently, and how it may be important to acknowledge that everyone's coping differently. So now we're going to transition into formal support. Formal support is really like an institutional support from the healthcare center, support from a psychologist or a therapist, supports from an organization like Momcology. This is from the mother of Martin. She says, after my son died, I think we had quite regular meetings with the previously involved psychologist, at least once a month or sometimes every 2 weeks, so we could cry and talk. Talking about all the emotions was really helpful. Mother of Ava also says, I sometimes have short moments where I miss her so much that I would like to join her. I can say something like that to my therapist. I can say something like that to her, but I know that something like that would trigger an uproar in my environment. And I would also like to honor and acknowledge that that is absolutely true in my experience as well. And then I really like this father quote, which I don't have highlighted here, but this is the father of Melina. He said, I never had the desire to go to a psychologist. I never had that. And you know what? Also okay. But I thought that these quotes were really nice. This was from a Vokinger article in 2025. Promise I'm wrapping up so that we can chat and also do a little bit more of an experiential exercise. How do we cope with all this? We have talked about such intense things tonight, navigating loss, so many changes, bereavement. First and foremost, allow yourself to grieve the small things, and certainly, most definitely, grieve those larger things. Grief knows no timeline. There's no manual, just like parenting or anything else that we get ourselves into. But another thing that I always like to say is feel your feelings. Like if we don't feel them, they will inevitably come out in some other way. So allow yourself to feel those feelings. Find a place when you can do it in your car alone, in the Momcology support community, to a journal, however it might be, try to feel and access those feelings. Again, I know sometimes that can feel like a luxury or a privilege because you have to take some time, but certainly try to feel those feelings. Build a support system. You guys are here. That's wonderful. This is a wonderful support. And also try to seek out some of those other supports around you, things that may be in your community, maybe neighbors or friends or other things that you've lost that you may want to try to reconnect with. Often we may feel like we don't know how to reconnect with people who haven't been through something that we have, but it doesn't mean that we can't try or find an opportunity and then see if that works for us. May not, but at least we gave it a shot. And then you can come to a more specialized support system or support community. Certainly, we understand the impact of our physical well-being on our overall emotional functioning, on the functioning of our families. If at all possible, trying to prioritize your physical well-being is really, really excellent. Sleep is a huge priority. I love my sleep. sometimes I might not exercise, but guess what? I'm getting my sleep. And actually, I have this conversation all the time with some of my friends who are integrative physicians. I'm like, turns out the literature's kind of split. They say maybe don't cut back on your sleep to go to that early workout because the sleep probably does you more benefit overall. So just something to think on. Mindfulness. We have done a couple of different mindful activities tonight, but also, again, being mindful, being aware of the present moment, noting it, understanding, hey, right now I'm feeling tense. That's okay. I'm not judging it. I'm going to sit with it for a moment. That's mindfulness. Hey, I hear my feet crunching on the leaves on my walk. Let me pay attention to that sound. That's mindfulness. So even just doing 1 minute of something like that can be really helpful with helping us cope with many different things. Getting creative. So anything that you can do that is creative for you, I don't mean you have to go take an art class. You totally can if you would like. But anything that you can do, creativity and engaging in something creative really minimizes and combats anxiety. And so that can be a huge component. Dr. Martha Beck, who is a very well known speaker, has a new book on this, many podcasts, and she has this really nice hypothesis about engaging in a creative endeavor and that really reducing our anxiety just by way of our focus being on this creativity um, activity. Practicing gratitude can be really helpful, whether you have a formal practice or whether you just try to think of a few things that are very specific to you in the moment that you are grateful or thankful for. I'm certainly thankful for the opportunity to be here, that my voice has held out. So making this grateful for things that are pertinent to that situation can make this practice even more meaningful to you and you can get even more benefit from it. And then certainly seeking professional help. You certainly don't have to do that, but it can be something that can be very positive for many people. Okay, I think I'm at around 48 minutes. Ooh, 8:57. Okay, I'm a little over, or I'm here. So maybe what we can do is take about, I'm moving this over, guys. Okay, we can take, if you still have your pen and your pencil and your paper, I invite you to just take one of these prompts and maybe I'll give you about 2 minutes. And if you want to take more than one, that's fine. But I invite you to take one of these prompts and just write about it. It could be in sentence form, it could be bullet points, you could even draw pictures that represent things, whatever is good for you. I either invite you to take what is one thing that you miss that you didn't expect to miss as part of being on this journey through having a child with cancer, or what is something that you lost that others may not see, or what helps me feel connected to my child or connected to a sense of hope, or what do I wish others understood about my journey. These are just for you. You certainly don't have to share. If you would like to, you can always share or put something in the chat about any one of these if you want, but also these are just for you. I can feel like we can cement our time together by really just having you personally explore one of these things. I'm going to be quiet for 2 minutes and let you all choose one of these and or pop questions in the chat for me as I'm happy to take those also. One more thing, I can make my resources available. So there's a few books that I really like, and then some online references, a podcast that actually a parent sent to me, and mindful self-compassion. I'm happy to make these available. I'm mindful of everyone's time. And then I found this quote that I think is just really wonderful, and it says, "Grief isn't something to get over. It's a part of love, and love never ends," which I just thought was so profound. So once again, I thank all of you for your time, for staying here and being with us tonight. I'm happy to answer any questions or chat.
Thank you everybody for joining us tonight. Thank you, Amy.
It's
That
so
was
love the heart.
wonderful.
You're so welcome.
Um, we had some really interesting question Q and A's tonight. One that just kind of got me in the heart was, does the feeling of grieving ever go away?
Hmm.
even with a successful completion of treatment?
I would kind of venture to say no. I can't know that for a fact. I think that it doesn't go away, it just may change. And other things like the grief might feel really, really big or profound, and you may grieve certain aspects of it. But I think over time, other things may fill some of those holes and take the place of some of the things that you're grieving. But I think the grief and just the processing of what you've gone through throughout that whole journey, Kat can, speak to this too, is just, I don't know that that's going to go away.
I
I
like
think it's
that.
just going to change.
I like the analogy about grief being like waves, in
Hmm.
that they can completely overtake you on some days and you feel like you're drowning. And then
Hmm.
other days that that grief can feel almost like a comfort because it's like a memory, or
Hmm.
it's a lovely washing of a water over you, and they're waves but they're not overtaking you. And I
Hmm.
do think that in many ways is somehow how grief lives in our lives indefinitely.
Hmm. Yeah. I think it's a continuation of love, and love never ends, right? I mean,
100%.
similar to that quote, like I've had people tell me that. I'm sure someone's, sided with that quote, but I think that's really lovely to think about it too.
There was another question somebody asked about how to support a friend that's going through a different type of grief than you. So if you have a friend who's maybe has lost a child, and maybe you have a child that's in treatment or off treatment and a survivor, or maybe you have a child, maybe it's somebody who doesn't have a child with cancer, and they're trying to relate. How do you how do you best support that friend?
Well, I think that much of what we talked about in the bereavement section can pertain with any loss. I mean, I think that was specific to cancer, but it can certainly pertain to that. So I'll dive into a couple ways that I think can be helpful. But I think acknowledging, right? Like that one mom says, even just writing a note, don't know what to say. I'm thinking of you, sending a text, you're on my mind. Giving yourself permission also, if you have a child who either is in treatment or maybe off treatment, and you're not sure that you can be physically present for that person, but you want to be present or support them in some way. I think allowing yourself to know what your boundaries can be to also take care of you, right? Like put your oxygen mask on first. You want to show up for this friend, and also you need to take care of your own needs. And so I think, sending a card at any time with, a funny memory or a happy memory or anything that you can related to whomever they've lost, if it's a child or something like that. Um, Sending a picture or just thinking about it. I think you just never know how impactful and how special and meaningful that is. I have songs with some of my patients. I share a lot of music with teenage patients, and still, when I keep in touch with some of their parents at times, I'm like, oh man, heard Skrillex, which is funny because he's this EDM guy, and it made me think of him, and I mean, it's years down the road, but every single time she's like, oh my God, thank you. So I think it can be any small gesture because so many people withdraw and disengage because they don't know what to say or they cannot tolerate it. And so I think if you show up or acknowledge in some way, you are offering some support.
And using names.
Yeah, saying their
That's a
name.
big one. Using
Absolutely.
names.
Saying their names, talking about them, saying that you miss them, offering memories, saying names, things like that. I think a
Yeah, I think
couple of people.
communicating that you're not the only one that remembers them, right?
Absolutely. Hmm.
But that
Hmm.
that friends do as well.
So a friend who lost their 2-year-old baby, and her daughter's moving into survivorship, and she's feeling like a grief imposter
Hmm. Hmm.
and moving through into and through survivor's guilt.
Just because your experience may feel or look different or may not be as bad or as significant or as long as someone else's does not mean that it is any less impactful and emotionally intense for you, right? And so when we start comparing our story to someone else's, it doesn't go well. It doesn't go well for many things, but certainly we are in our own journey, our own navigation. I think that having survivor's guilt is so real. You know, if even if you are in and out of an oncology clinic for a short time, my guess is that you're going to encounter, or in and off a floor, an inpatient oncology floor, you're going to encounter families and children who are not going to survive. And having survivor's guilt is real. And acknowledging it and being mindful of it and trying to take as best of care of yourself as you possibly can is really important. There is not a right or wrong way to cope with that. And you're going to have ongoing challenges navigating life after with your survivor, right? And so again, flipping back to the question prior, like how do I support someone if my friend, you know, lost their child and I have a child who now, you know, is in survivorship. And I think again, kind of going back to some of those points of when and if you're able to, right? Showing up in whatever capacity that you can and honoring that legacy of the child, keeping that child's memory alive, and just showing some support in some way. But survivor's guilt is real. It's real for our children because they know other kids who didn't survive and watched it.
For sure.
And then and kids who relapse and they didn't, and you know, it's real. And so I think just not trying not to compare your journey to anyone else's can be really, really important.
That quote, what is that quote? Comparison is the thief of joy.
Thief of joy. Yeah.
Yeah, I have a friend who has probably incurred more loss than anyone I can imagine in life, and including what we're talking about today more than one time. And the fact that that individual can say to me, comparison is the thief of joy,
Mhm.
is the amount of grace that that takes to be able to offer that to other people. It just tells me that it's real. Like that's a real
Mhm.
thing. And it's okay to have our own experiences and feel them and feel bad about what we're going through and still also have compassion and love and grace and honor
Mhm.
um, for our friends and who have lost their children and who we've walked through that journey of grief with. I think that you can do both.
Yeah,
Right,
for sure.
right. Amy, we just got a really good question that I'd love to have you
Sure.
address. Do you feel that parents with PTSD from trauma of their child fighting cancer and then ultimately passing should seek therapy? Um, do you think that can even help if they haven't experienced what you have? And I wonder if you could also offer, this is a question that I think we frequently hear in conjunction with this, any tips that you would have for identifying a therapist that would be appropriate
Mhm.
um, for a bereaved parent?
Therapy is not a one size fits all. Not all therapists are a good fit, right, for each individual. So I think I'm going to start with how to identify a therapist first, because I think that's a little bit easier. One is if you go back to your medical center and you ask maybe a clinical social worker or somebody who you feel comfortable on the team, or if you ever had a psychologist or access to a psychosocial provider at the hospital, even if it's been a very long time, reach back out and say, hey, do you guys know or work with anyone who sees bereaved parents? The other thing could be reaching out on, you know, through an organization like Momcology on some of the boards or things like that and asking, you know, other parents or things like that if they have, you know, any experience or knowledge of other things. Um, but I think going back to your institution can be helpful. Like we have certainly some folks who we don't necessarily recommend, but we say, hey, we've heard from parents that they've worked with these people. Or sometimes providers who have been at the hospital, especially now with telepsych and telehealth support. Like I see all of my bereaved families virtually. And so it takes away that barrier of them having to come back to the medical center. Sometimes they want to, many times they don't, and that's also okay. So that can be really helpful. If you've had a relationship with someone, you may be able to kind of go back to that, and then they know the story, and you're not having to rehash all of it. Uh, Alternatively, it can sometimes be really, really nice to get a brand new person and share and also share what you would like. So I'm a huge proponent of therapy. I mean, I don't know if I'd be a good psychologist if I didn't encourage people to at least give it a shot. But I also think that, like, even if it is not for something very specific, you have been through so much. You've been through a really intense journey and had a child go through so much, and then ultimately, experience probably the worst loss that you can. And so I think that even if you feel like you're doing okay, therapy can be helpful. And you get to decide, you and your therapist, you and your psychologist, you get to decide how often, you're going to be seen, in what context, what your goals might be, and anything. So yes, I think even the most healthy, well-adjusted person could show up with a therapist and like have some goals of maybe what they may want to improve, and that therapist or psychologist could help them. So I think that could certainly be worth a try. Just knowing that you may not always hit it off with someone immediately, and that's okay. Or you may have to, try another person. But I definitely think that it can be really helpful. And then with regard to very specific conditions that may come up, like PTSD or complex or prolonged grief, things like that may be grief that we see that is maybe out of the ordinary or impacting every single aspect of your life and really limiting your functioning for a long time after loss. Those sorts of things therapy can be quite helpful with as well. Um, so I would say that that could be something to consider as well, because there are standardized treatments in some ways for some of those presenting issues that can really help you improve functioning.
I think part of that question, the second half of that question is interesting. And maybe you can address this because this is something that is actually a little bit more universal. It's about seeking therapy and having somebody be helpful to you who hasn't experienced what you're going through. And I think if you could speak a little bit about the difference in what we offer, which is peer support and shared experience, versus what can be offered by a trained
Mhm.
clinician who doesn't have this shared experience but can help you in different ways. Can you talk to that a little bit?
So yes, absolutely. So I think there's room for both. I mean, I think the bigger in your support community, the better. I tell all of my patients this. I'm like, I'm only one support, but like you need your friends and you need your family and your sibs and your community group and all these things. So the more support, the better, because if you think about it, grief can show up in all different areas of our lives. And so understanding how we may respond and hearing from a peer or hearing from our mom or dad or our spouse what they think, you know, can be helpful. But also hearing from an unbiased professional who's been trained in how to handle, right, generalized anxiety or, bereavement issues because they've done additional professional training on things like that, even if they have not lost a child themselves. And sometimes you'll be surprised who you may go to and what they may disclose. While it is not exactly the same, they may have helped similar families through something that you're presenting with, or they may have experienced a loss themselves and can relate or connect with you, depending on what that might be, even if it's not the exact same shared experience. But I think that professional therapy and support can be extraordinarily helpful. There's reasons we have to have a license because we have to be ethical and we have to do our continuing education and we have to protect the public. And the other supports that you may get or people who you ask an opinion of may or may not come from that same background. And often they have their own um, kind of bias with which they come to the table perhaps with. So your friend's going to be like certainly looking out for you. This is what I tell my teen patients all the time. Like certainly they're looking out for you. They're your bestie. And also they're thinking about how your behavior may impact them, right? Because they're your good friend. Whereas your therapist might be like, I don't know about this friend, right? Like tell me more. And the therapist doesn't know your friend, like they aren't trying to badmouth the friend, but they're looking at this from an outsider's perspective to take care of you because you're their patient, you're their client. So
I like
hopefully
that.
that was helpful.
Thank you.
Thank you.
Thank you.
There's room for everything.
Room, absolutely. The more
Room
support,
for
the better.
everything.
More
And
support,
it
the
does
better.
take time. It does take time to build a therapist is a
Absolutely.
relationship, and they don't have to work every time.
Mm-mm.
And that's
Mm-mm.
okay.
Yeah. Yeah.
And that's okay. You
And then
can
I think
find it.
sometimes they can be seasons, you get I personally have had
Absolutely.
various therapists or support, when I was like a fellow and I would go in and just talk about me learning and working with all these patients and the complete overwhelm I had. And then now I have a different therapist and I talk about parenting and spousal relationship, like all
Right.
kinds of different things that may show up at different times and different therapists may be helpful for different things.
That's a great point.
Hmm.
And I think, Amy, what I also take away from this is that even though we got this question
Hmm.
in the context of losing a child and a bereaved parent, I am guessing, correct me if I'm wrong, that your advice would be the same um, for parents of kids who are on or off treatment as well,
Absolutely.
right? Build
Yeah.
that network of support that we
Hmm.
have and to get that um,
Yeah.
therapist perspective, understanding, as what you said so much tonight, a lot of this is individual, right? We won't all react in exactly the same way to similar themes, but
Hmm. Hmm.
thank
Yep,
you. I think that's a great question for everyone in the room
for
tonight,
sure.
including, but not exclusively, our bereaved parents. Yeah,
Hmm.
thank
Well,
you.
those were great questions. We have gone well over
Yeah,
our time. Almost everybody has stuck with us the whole time. Thank
I
you,
know. I
everyone
appreciate
in
you
the room.
all. You're gonna be
Um,
like, where are you? No, just kidding.
it's wonderful. This is great. Thank you everybody for joining us tonight. There is some information in the chat for
Hmm.
our next caregiver lounge. Um, May 29th is the date on that one, and we will be talking about relationships and intimacy with Greg Hedler and Beth Scala from CHOP. So that will be an interesting conversation, and we hope everybody will join us. Um, and then momcology.org, take a peek, events coming, and we'll keep everything up to date there. Registration will be available on the website as well. So we'll keep everybody up to date. Layla, do you have anything to add before we sign
just want to
off?
say, Amy, on behalf of Momcology and all of our attendees tonight, I just want to say thank you so much for taking the time to be with us tonight, for your thoughtful insight, and for your bonus time these past few minutes answering some extra questions. We really appreciate it and consider you
Yeah.
a gift to our families. Thank you so much.
Thank you all very
Thank
much.
you,
I
everyone.
appreciate you all. Good night.
Thank you. Good
Bye.
night. Have a good one, everyone.
Bye.